A common neurological call that EMTs get called for is a headache. It's just something that causes a fair amount of pain for people. Sometimes it's different than what they are used to, so they call 911 and want to get evaluated. I want you to realize that headaches may be the condition, or they could be a symptom of another condition, and that's something that we have to investigate, because not all headaches are the same. The pain can come on very suddenly, or it could be something that's come on fairly gradually, more of a constant type pain, or maybe a type of pain that's fairly reoccurring to them. And people that oftentimes get headaches usually, or people that often get headaches usually will know what their normal headache is like, and if something is different, that's when they'll call for us. So it's something we have to take seriously. They may describe the pain as mild, moderate, severe. I always ask them on a scale of 1 to 10, how bad is it? And I also ask them to compare it to previous headaches to see if it's any worse or any different than any other headache they've had before. There's a few different types of headaches. Vascular headaches is probably one of the more common severe type of headaches, and migraines fall under vascular headaches. And this is typically thought that there is a dilation of blood vessels. Now, with a migraine, they sometimes feel that there's a spasm of the blood vessel, and then the vessels dilate, and there might be some chemicals that are released from that, and that seems to be what's causing the pain. A lot of times patients with migraines will know this is a migraine. They may not have taken their meds or may have been out of their meds, so that's why they're calling us, or it may just be worse than normal, but it follows kind of the same progression for them. Sometimes they experience a bit of an aura, so it might be something that they feel or taste or hear before it starts, kind of like a seizure, but they're not seizures. At least we don't think so. They usually affect one side of the one side of the head more than the other. So it's usually limited to just like one side of the head. They'll oftentimes describe it as very severe, might be throbbing. There's usually some sensitivity to light, so they don't like the bright lights. They want to be in a dark room. They don't like noises, so a lot of times they need things quiet. And they might be hot or cold, so a lot of times you find them in a bed, in a dark room, curled up, blankets over their heads, just trying to stay still, trying to stay quiet, trying not to see the light. And many people that have migraines will feel nausea and will vomit from it. And sometimes they say that if they vomit, they'll just feel better afterwards. Another type of vascular headache is a cluster type headache. And with cluster headaches, it's not a full migraine, seems to be a little bit different, oftentimes not quite as severe, but can be very debilitating and very painful. Usually affects one side of the head, and a lot of times will come in and affect the face, and they'll have some tearing with it, maybe some congestion, runny nose type stuff, which is kind of strange from a headache, you would think, but that seems to be pretty common for cluster type headaches. And even their skin on their scalp and their face may be very tender if you touch it. Tension headaches are probably one of the most common type of headaches, and you've probably experienced that where you've just been leaning over a screen or staring at your phone too long or intent on something, and you just get tension in your neck and your shoulders, and that tension seems to cause pain, muscle soreness. So a lot of times we describe this type of pain as sort of a squeezing, a tightness, a band, pressure, and it oftentimes will affect both sides of the head. And sometimes rubbing on the neck or the shoulders seems to make it temporarily a little bit better. There's usually no nausea and vomiting with these, and they're usually not as severe as migraines or cluster headaches. But if someone has never had one before, or if this is much different, then we want to get that investigated. And finally, there's organic type headaches. And organic headaches can be very mild to very severe, because these are all due to some other condition. And it could be like they're having a stroke, or they have a brain bleed from a traumatic brain injury, concussion, head injury type deal, meningitis or some other infection of the brain. High blood pressure can do it, hypoglycemia can do it, hypoxia can do it, exposure to other chemicals and toxins can do it. Sometimes even just a fever and just not feeling good causes a bit of a headache. But these are usually, well, I'll take that back. I'm not going to say they're usually less severe, but there's usually some other signs or symptoms that go along with whatever condition is causing the headache. But sometimes headache is the first sign or symptom that there's another condition. And this is why if a patient's never had a headache like this one before, or it's much more severe than normal, or just very different than normal, I really suggest that we take them to the hospital and get them evaluated. And of course, we know that if somebody ever says this is the worst headache of their life, I think I'm starting to slur my speech. they might be having a stroke, which I thought was funny about slurring my speech. I can smile, both sides of my face go up still. I'm doing all right. But anyways, worst headache of their life. Never had one this bad before. You got to think stroke. So take them to the hospital, let them evaluate it and see if they can figure out what type of, what the problem is, or at least rule out the stroke and see if they can figure out what's causing the headache. So not a whole lot of treatment we can do for patients with headaches. Make them comfortable, realize that loud noises and light can make headaches worse. So we want to stay calm, speak calmly, quietly, try to minimize lights. I know sometimes it looks bad to pull a sheet or a blanket over our patient as we pull them out of the house, but if it's a bright day outside, you might want to do that to minimize some of the sunlight that they're going to get exposed to. Of course, in the ambulance, try to keep things as quiet as you can. Watch the beeping on the monitor. Assess your vital signs, assess your airway. Check blood sugars, because that can cause a headache. Check your pulse ox and make sure that you have oxygen saturation of 94 to 99%, because that could be a problem with the headache or causing the headache, hypoxia. Monitor your vital signs, look for hypertension, see if that's there. Do your stroke test, to whichever stroke test you use. We use the FAST exam, most common here in Alabama. So do that and see if they have any other signs or symptoms of a stroke, and then transport them, and generally transport them non-emergency, position of comfort, however they can get comfortable to try to minimize their pain, and just do supportive care out to the hospital. So that's a little bit about headaches. Hope that helps you in your study for your upcoming neurology exam. And if you have any questions, please leave them in the comments below or ask me in class.